The issue for sentinel lymph node biopsy in melanoma is a very crucial one because it provides very important prognostic information and also guides us in our decisions regarding the use of adjuvant therapy or clinical trials. So the recommendations vary a little bit across countries and even within the U.S. and different centers. But in general, we're looking for patients that have a risk of a positive sentinel lymph node, which would be based upon a couple of factors: the thickness of the lesion in millimeters, the breast lobe depth, and then the presence or absence of other prognostic factors in the pathology specimen which direct you. So non-controversial recommendation for sentinel node biopsy would be any lesion more than 1 millimeter thick. I think most centers would agree that those patients should all undergo sentinel lymph node biopsy. If the lesion is less than a millimeter thick, we look for other prognostic markers, such as ulceration. So if the lesion is ulcerated, as defined in the pathology report, then we recommend that all those lesions should undergo sentinel lymph node biopsy. Also, we don't always look at Clark level, but for a Clark level 4 or 5 lesion that is less than a millimeter, we strongly consider the use of sentinel lymph node biopsy as well. And now with the new prognostic marker of mitotic rate, a mitotic rate of more than 1 per high power field is also considered at our center a indication for sentinel lymph node biopsy. Where the controversy might come up a little bit is with the depth of 0.75 millimeters, and some centers would do a lymph node biopsy cutoff at 0.75 millimeters and not the 1 millimeter cutoff that I mentioned earlier. And that is certainly the practice at our center as well. I think if those patients are targeted to do the sentinel lymph node biopsy, then those are the appropriate patients to stage very accurately with the surgical procedure, and then based upon that, further decisions regarding completion lymphadenectomy and then possible adjuvant therapy and clinical trials can be made at that point in time.